An old brick building with green, ornate accents stands against a blue sky. Dr. Carina Marquez, wearing a white lab coat, sits on a stone bench in a garden, smiling.
I'm Carina Marquez.
Dr. Marquez speaks to the camera, wearing a vibrant pink blouse with floral embroidery. Text appears, Carina Marquez, MD, MPH, Associate Professor of Medicine. The Zuckerberg San Francisco General Hospital and Trauma Center sign is visible in front of a modern hospital building.
I am an Associate Professor of Medicine here at UCSF, based at San Francisco General Hospital.
Dr. Marquez walks away from the camera down a hospital hallway.
And I came to UCSF as a medical student.
A door sign reads, Office Carina Marquez, MD, MPH, Associate Professor of Medicine. Inside, Dr. Marquez is at her desk, looking at a computer.
In 2004 and been faculty since 2015.
An over-the-shoulder view shows Dr. Marquez looking at a computer screen displaying a PowerPoint slide titled Unidos en Salud, Community-Based Research.
I got into medicine and research with the hopes to bridge community and clinic.
An old family photograph shows several adults and 2 young children, one an infant.
I think in part starting with my family history. I'm the
Another old photograph shows a woman smiling with 2 young girls.
Daughter of immigrants, and I think through my family history and personal experiences saw firsthand health inequities and some of the barriers in healthcare access.
Dr. Marquez, wearing a light blue mask and a white and yellow floral shirt, stands in front of a building with a large, colorful mural depicting multiple figures, including people, candles, and graffiti art.
And so that firsthand experience, I think, really motivated a lot of the work I do today in the community.
Dr. Marquez walks past a green fence with a sign pointing to COVID-19 vaccines.
And one of my clinical roles is as the director of the Salud Clinic.
Under a white tent, a medical professional in purple gloves prepares a blood sample, while Dr. Marquez and 2 other masked individuals observe.
It's a clinic that is focused on delivering
A family, including a man, a woman, and a young child, all wearing masks, walk through an outdoor clinic area with tents and decorations.
Multidisciplinary language-concordant care to Latino patients.
The family sits in chairs, wearing masks, with a medical professional at a table in the foreground. Close-up of an adult's hand holding a child's hand.
We're really trying to reach the community that is not connected to care yet.
A medical professional in a white lab coat and mask leans down to speak to the young child, who is sitting on the man's lap.
And during COVID, we very quickly saw huge disparities emerge.
An exterior view of the modern Zuckerberg San Francisco General Hospital and Trauma Center building. Dr. Marquez, in a white lab coat, walks confidently through an outdoor area of the hospital campus.
Within San Francisco General Hospital, over 80% of our patients who were hospitalized were Latinos, mostly frontline workers, low-income workers.
A group of masked people gather around a white tent at an outdoor clinic listening to Dr. Marquez. She and another woman, both masked, stand next to a table where 2 people are using laptops. Dr. Marquez, wearing a green jacket and mask, talks to a masked man.
And we knew to do anything that it had to be with community in true partnership.
A sign displays Vacunas COVID-19 Disponables Acqui/COVID-19 vaccines available here with various organization logos.
And so that's what we did very quickly.
A person with curly hair walks away from the camera, wearing a maroon jacket with SF Latino Task Force printed on the back.
We were lucky to find great partners with the Latino Task Force.
A masked woman in a maroon jacket with the SF Latino Task Force logo on her sleeve gestures while speaking to a masked man.
Our community partners bringing this knowledge of the community, what people need, how to...
Under a white tent, a medical professional prepares a blood sample, observed by Dr. Marquez and 2 masked individuals.
Communicate information, the trust, and then we need those...
Dr. Marquez, masked, gestures with her hand while talking to a masked man and woman.
We're here as their partners bringing...
3 masked women, 2 in medical attire, work at a table under a white tent, handling test tubes and paperwork.
A lot of the medical knowledge, the testing capability, and that partnership, I think, created something very beautiful.
Under a white tent, a medical professional performs a finger prick test on a patient, while Dr. Marquez and a masked man observe.
We've been able to do over 100,000 tests, 70,000 vaccines.
A masked woman holds up a small white card, smiling at the camera, with other masked people in the background.
To this day, we're still hand in hand delivering non-communicable infectious disease testing from HIV.
Dr. Marquez, in a yellow sweater, walks down a hallway with another woman, both speaking.
To hypertension screening, to think about not just COVID, but a more holistic view of health.
Dr. Marquez leads a meeting with 3 younger colleagues at a conference table, with laptops open and a screen displaying AIM-3 updates. A young woman with long dark hair smiles and looks to the side during the meeting.
When I think about public service, I think the true meaning is really community. And
Dr. Marquez, in her white lab coat, sits in the garden, looking up and smiling.
Partnership. And that, I think, was one of the things that really made this work possible.
The screen fades to white. Then the UCSF logo appears on a dark blue background.